Hi everybody, this is Christian Brindle here. Hope this video finds you doing well. And today I'm going to discuss Medicare and Medicaid and how they work together if a person is eligible for both. So let's start with Medicare. Medicare is a federal program for people that are ages 65 and older. People pay into Medicare in the form of FICA taxes that pay into Social Security and Medicare that the government holds on to and is, in theory, supposed to pay back to you in the form of giving you medical coverage once you reach the age of retirement, which in their eyes is age 65 and older. However, people can get Medicare under the age of 65 if they have Medicare disability, which means if you're on Social Security disability for 24 months consecutively, you will automatically be placed on Medicare disability. Medicaid, on the other hand, is something that's regulated through each state separately, and most states, they work differently as far as what benefits and criteria they base things on. But in a whole, Medicaid is assistance for people with low income when it comes to Medicare. People that have Medicare and Medicaid are able to get both, and the Medicaid actually works as a subsidy and subsidizes that person's Medicare. Now, Medicaid can also be had for children, people with disabilities, and other different types of situations, but today we're going to primarily be talking about how it works if someone has Medicare as well as Medicaid. So, like I mentioned, each state is a little different on how their Medicaid program works, but basically what we're talking about is Medicare acts as the person's primary insurance, and it pays about 80% of medical bills after deductibles and coinsurances are met. Medicaid works as a secondary and comes in and pays that 20% and pays what Medicare does not pay, assuming the person has a high enough level of Medicaid. Keep in mind there's different levels of Medicaid that determine a person's level of subsidy. Now, when a person gets Medicaid, in most areas, they're automatically put on a program called Extra Help, also known as Low Income Subsidy, which helps pay for their medications. It's very common for people on Medicaid to also have their Medicare Part B premium paid for them of $135.50 per month at the time of recording this in August of 2019. The Medicare Part B premium can change year to year, but a lot of people on Medicaid, if they have a high enough level of subsidy, can have that paid for by Medicaid for them. Medicaid will typically come in and pay what Medicare does not pay. When a person has Medicare and Medicaid Parts A and B for Medicare and Medicaid from their state, if they don't take the actions and the steps to pick up a Part D, as in dog, plan, which is D for drugs, for their prescription drug coverage through a private insurance company, they will automatically be enrolled into one by the government automatically at random. So if someone on Medicare and Medicaid wants to avoid that, they should make sure they pick up a plan right away when they find out they're eligible for both of these programs. There are programs out there known as special needs plans that work with people that have Medicare and Medicaid, and the eligibility varies on the person's particular situation and their level of Medicaid. Medicaid will not only pay the Part B premium of Medicare, but it will also pay, like I mentioned, in most cases, everything that Medicare does not pay, so the person is left with full medical coverage. They would have similar coverage as if they had a Medigap or a Medicare supplement. The benefit is they just don't have to pay for that. Medicaid also provides a lot of beneficiaries in most areas with some kind of dental coverage. A lot of areas will provide vision and sometimes hearing coverage and various other benefits that Medicare does not provide on its own. They will also help pay the premium on the Part D drug plan if there is one, and they will help pay an enormous amount of that person's medications. So if a person that has Medicare and Medicaid My recommendation as a Medicare expert and specialist is that they should make sure they're getting a special needs plan if they have one in their area, because they could pick up a tremendous amount of additional benefits without paying any extra premium for them. Thank you so much for watching this video. I hope this helped clear up how Medicare and Medicaid work together. Have a great day. Please subscribe to our channel for future videos, and as always, if you live in Utah, Idaho, Florida, and soon to be Oregon, and you'd like to work with me on your Medicare health plan, if you have questions, concerns, whatever the case may be, I can help you, and we're going to put our phone number and contact information up on the screen. Have a great day.